everyone. I am Dr. Shweta Ashok Harnal and I am a fertility specialist at GarbhaGudi IVF Center, Jayanagar branch. So whenever a couple comes to us saying that they are not able to conceive for some time, they ask us a common question saying how long will it take for us to get pregnant? The first and foremost thing that we do is we evaluate the couple well by doing a scan or doing some blood tests and a semen analysis. So considering all these factors, we come to a conclusion what kind of treatment they need. And how long one will take to get pregnant depends on all these reports, and sometimes it is not a fixed time like that. Whenever a couple is having a very severe problem also, they conceive in the first cycle, but when they are not having any problems with the semen analysis or with the scan or with the tubes, they take a little longer to conceive. So if you ask me like how long will it take for an IUI cycle or an IVF cycle or a natural cycle, so whenever we are looking at a natural cycle or an IUI treatment, it takes one cycle for us to complete one cycle of IUI. We try to do 2 to 3 cycles of IUI before we come to a conclusion whether it is working or not. So every treatment cycle is one period cycle. And when we are talking about natural cycle, again it's the same thing. We monitor the follicle and then give a trigger injection for the follicle to rupture and ask the couple to try. So that one cycle is also one period cycle you can consider. So when we are talking about IVF treatment, we usually do the egg pickup in one cycle and then we wait for one cycle, and then in the next cycle whenever we confirm that there are no cysts persisting, we plan the patient for an embryo transfer. But there is no definitive answer for when one will get pregnant. About 50 to 60% will conceive in their first cycle itself, but there are few couples who might take a little longer to conceive. But overall, when we are looking at how long will it take, this is the time period for an IUI or an IVF cycle. Thank you.